Are your hormones out of balance? You might be struggling with acne, trouble losing weight, maybe losing hair, or maybe it's your cycles that are totally all over the place. Well, you may have something called PCOS, polycystic ovarian syndrome. And to this day, something I dealt with years ago, I am still shocked by the amount of confusion around PCOS. There's a gut story to PCOS, there's a liver story, and at the end of the day, it's an autoimmune disease. So we really have to think about it in the context of inflammation. If you've been struggling with any of these symptoms, or you might be suspicious that you've got PCOS, this is the webinar for you. We're going to break down the science and talk about the latest research. In fact, there was a whole consensus on PCOS done by the Society of Endocrinology just a few years ago, but it's not being clinically practiced. So jump in, enjoy the webinar, and learn more about your symptoms, PCOS, and what the right plan might be for you.
Hi, everyone. How are you guys all doing today? Are we ready to talk PCOS? So I feel like, this is an issue that's near and dear to my heart. It's what got me into integrative medicine and holistic medicine. I really had to find the answers for a lot of the symptoms I was having in my 20s, which was a long time ago, but really led me on this incredible journey. But the information continues to shift and change. I just wanted to review some of it with you and make sure everyone had a good understanding of it, but also tackle more of the East-West approach to it. We've done PCOS webinars before, and we're going to review some of what we've done before, which is the basics of symptoms and hormone patterns and things like that, but really wanted to talk about thinking about PCOS from a different angle completely. So let's jump in. We're going to move on to this first slide. Let's see, there we go. All right, so just to set the framework, you guys know I like to do this if you've been following me for a bit. But we know that, almost 10%, I would say a lot of people are undiagnosed. So 5 to 10% of women are estimated to have PCOS. I would argue that it's higher. It is heavily prevalent among Latinas, South Asians, Indians like myself, African Americans. We have higher percentages, but I do think it's equalizing across all races. And there are a number of different reasons for that. And we'll get into that shortly. Moving on from there, again, I didn't start with the most basic question. We were just laughing about this today. People ask me what PCOS is. So hopefully everyone knows if you're on here, it's polycystic ovarian syndrome. But the symptoms are diffuse and varied, and not everybody has all of the symptoms. When we were in medical school, we had this classic picture of PCOS that was put up on the screen of someone who was, very overweight, balding, facial hair. Well, a lot of us are not that extreme. We're this little subtle shades of that stuff. So we might have the hair loss, we might have acne, we might have weight issues. And the more we're learning about PCOS, we're learning it's a little bit more complex than that. But I've listed here some of the most common symptoms: acne, hair loss, irregular periods, pain with your menstrual cycles, obviously ovarian cyst, and then weight gain, really because insulin levels stay chronically elevated. So this is weight gain that is unexplainable, weight gain that is very difficult to lose and very stubborn. So, and then for many women, and my biggest takeaway with PCOS is that it's not just a disease of your 20s. It is really truly something that stays with you through every decade. And for many women who get pregnant, losing weight post pregnancy, menopausal weight gain, all of those are impacted by this condition of PCOS, which is high androgens, high insulin, estrogen dominance, and having issues with hormone balance in general. All right, so that's what we've got there. And then the surprising symptoms, the ones that many people are not aware of or forget or don't think, many conventional doctors too don't think that these could potentially be tied to PCOS, include joint pain. Remember, PCOS is an autoimmune disease, so joint pain is a part of this for sure. General fatigue, and we see that over and over again because most of my patients with PCOS have methylation issues, meaning they have MTHFR as a genetic SNP, or they have COMT as a potential genetic SNP. And yes, you can get these SNPs checked and they're helpful information, but what they essentially tell us is that your body's not going to be very good at moving hormones through, and you're going to be at risk for having hormone levels that skew towards either high estrogen or high androgens. Methylation issues too, remember, also hint that your liver is more sluggish, and we're going to get to that more in just a moment. Your belly is an important part of the PCOS syndrome. The majority of my PCOS patients have either gluten intolerance or have candida or an overgrowth of yeast. And I see this pattern over and over again. And that in turn, remember, a lot of the insulin issues that we talk about with PCOS are actually coming from gut issues. So, my story in particular, you clean out gluten. I have to watch sugar and dairy. And as long as those things are well managed, my insulin levels will usually behave. If I go off track, then they don't. And the belly bloat comes back, gaining weight very easily comes back. All of those symptoms come back. And then I'm also seeing a lot of anxiety and depression tied to PCOS. So in our young adolescents, before they're diagnosed with, ovarian cyst, if they're having bloating, belly pain, if they're having mood disturbances along with irregular periods, those are also a part of this PCOS spectrum because, again, the methylation issues, the hormone imbalances, all of those things we're finding in our young girls too. Again, this is in our family, and I think I'm starting to see this in my daughter as well. So it's important for us as moms to be aware of this too, so that we can start to put our children or our younger children on the right path so they're not getting into their 20s and having major health crises as they're in college and then away from us. So again, there's this huge connection. Of course, fertility and infertility also connected to PCOS as well. All right, but what I wanted to do, since we've done previous PCOS webinars, what I wanted to do today was spend a little bit of time in the Chinese medicine way of thinking about PCOS. So they really, this sort of system of medicine, I'm so fond of, and I think it truly healed me at the end of the day. But remember, PCOS in Chinese medicine has specific patterns. And it's just to give you a crash course on Chinese medicine very quickly. Remember, it's an energy based system of medicine. They believe that highways or pathways or meridians are running through the body. You have all the different acupuncture points on the meridians, and disease happens when those highways are blocked, right? When you can't have movement of energy through there, that's when disease historically happens. So the most common Chinese medicine patterns of PCOS, first of all, involve the liver. They talk about liver meridian deficiency or liver blood stasis, meaning that the liver is simply not able to do its job. And when it doesn't do its job, you either have deficient hormones where you're not making enough hormone, or you have hormones that congeal. They literally visualized it like as this mass, that's just sort of got all sticky and kind of stuck together. And that in turn would lead to ovarian cyst or fibroids or some of these things that we often see with PCOS syndrome. So that's one pattern. Of course, the Chinese medicine treatment of that pattern would be acupuncture to help move the energy along the meridian. But oftentimes, with acupuncture, especially in deficiency states, especially when they thought the body did not have what it needed, they would also use herbal medicine. They would use moxibustion, cupping, some of these other things to get energy moving, to build chi. That's the way they would think about it. We got to build chi. And then that in turn would hopefully re regulate the hormones. If any of you have had acupuncture, you know the powerful impact of acupuncture on our hormones and how it plays such a critical role in regulating hormones for many different conditions, but definitely plays a role for PCOS. The second most common pattern in Chinese medicine is spleen meridian deficiency. So the spleen, remember, is responsible. It's the master digestive meridian in Chinese medicine. So when the spleen is off, according to Chinese medicine, the rest of the body will be thrown out of balance, out of homeostasis. And so that's where, they would take a hard look at where the spleen was blocked. They would historically, and here's where the overlap between Western science and Eastern wisdom comes, but they would historically take people off of dairy, fatty foods, things that were overly sweet, because they believed that that would create more stagnation. Well, all of those things that I just mentioned actually make candida worse. They make yeast worse. And that, in turn, from the scientific part of it, we know drives insulin, and that insulin drives the androgens and then drives the whole syndrome. All right, the third pattern in Chinese medicine to talk about, they talked about gallbladder meridian deficiency. Now, we all know where the gallbladder is, right? It sits right up here on the right side of the belly. We've heard about gallstones. We know what that, we've heard tales or we've experienced what that feels like. But the gallbladder, remember, functionally is responsible for digesting fat, so digesting meat, digesting dairy. In Chinese medicine, PCOS, the way they described it or the way they talked about it, was based also in a pattern where the gallbladder meridian was deficient. It wasn't working very well, or it was having to work too hard. Here's where the science comes back in. With the gallbladder, we know it's responsible for fat digestion. If it's not digesting fat well, then we end up in a state where the gut and the body in general is having fatty acid deficiencies. When there's not fat being well digested and well absorbed in the body, you get constipation, you have hormone imbalances, and you have a tendency towards candida or yeast overgrowth. So that connection between what Eastern medicine kind of recognized and what Western medicine is sort of proving when it comes to a condition like PCOS and so many others continues to fascinate me, but more importantly, gets results for folks. So many people with gallbladder meridian deficiency will have trouble with meat, they'll have trouble with dairy, they will have trouble breaking these things down. And then when we look at their stool, they're usually spilling fat in their stool, and that in turn leads to a higher histamine response, higher candida, and that is driving the insulin component. So hopefully you followed all of that, but that's kind of the Chinese medicine way of looking at it, which is very much connected to science today. Now, which pattern do you have? All right, if you are somewhere, I know you're looking at me on the screen and looking at the slides, but maybe you've got your phone nearby, pull your camera up, stick your tongue out for 2 seconds and look at your tongue in there and see if you can tell what color it is. If it's dark and kind of purplish in the middle there, that goes with liver meridian deficiency. If it's yellow, which with a nice thick coat there, especially towards the back, then that's spleen meridian deficiency or spleen meridian imbalance. And then when you stick your tongue out, if you have the bite marks down the sides of the tongue, that is more consistent with the gallbladder. But it just is such a powerful tool to know what direction to go in when we're trying to help people with PCOS, because there really are so many different patterns. And at the end of the day, everybody's story is really their own. All right, let's move out of the world of Chinese medicine for a second. We're going to move on to Ayurvedic medicine. This is an old Indian system of medicine. And so much literature there, so much knowledge there. So just like Chinese medicine, I always say kind of jokingly that the two are very similar. They just have different languages. One's using Sanskrit and one, of course, is using Chinese. But the pattern of PCOS most associated with in Ayurvedic medicine is being pitta dominant or having excess pitta. And pitta, remember, is that go-getter. You're my boss ladies in the Superwoman RX, but you're getting things done, you're accomplishing things, but you're holding all of that stress in your gut. And what happens then is that the gut sort of collapses or has excessive heat. That in turn triggers inflammation, and that in turn triggers all the different hormone imbalances. So Ayurvedic medicine also has a way of looking at heat and diagnosing based on doshas, pitta, kapha, or vata. I'll give you a quick cheat sheet to figure out which one you are. With pittas, generally, you're more athletically built, more of a medium frame. You have a tendency to have more red rashes, more digestive issues. The kaphas are nurturers. They take care of folks. They hold on to weight more easily, whereas my vatas are more creative. And I write out about a lot of this and how to figure out your type and your, not just your dosha, but your power type by merging all these different systems of medicine together in the Superwoman RX. So if you guys haven't done that quiz, or check that out, I strongly encourage you to do that. There's so much information there that I'm hoping will be helpful to folks as they journey through just being a woman. So much fun. All right, so that's the Ayurvedic piece of it. Now, let's talk about managing PCOS in general, and then we're going to bring the Ayurvedic and Eastern part back into this picture. So this is sort of how my brain works, right? Like my brain is always like, well, diet is the foundation. Where do we go from diet? What can we do next? And I'm always thinking with PCOS, I'm thinking in triangles. So I'm thinking about the gut as a cornerstone of what we need to deal with. Then I'm thinking about methylation, which is do you or do you not have the ability to move things through that liver effectively? If not, then we have to do some liver work. And then where are the hormones? Which particular hormone pattern am I dealing with? So if you think of a triangle, these are on each of my corners of the triangle. I call this the PCOS spectrum, but beyond that, everybody's story pretty much gets individualized in the practice. And then we can generalize here just to make sure you guys know the patterns. So with diet, because so many of you guys have gallbladder meridian issues, because we're seeing so many digestive issues with PCOS, candida, and gluten, the ideal diet is really getting in more of those healthy fats, a lot of plant-based foods, but not necessarily vegetarian or vegan, reducing sugar to oblivion, and then really lowering gluten and dairy, really trying to get it down as much as you can, down to a few servings a week at most. With the supplementation part, without knowing everyone's personal story, I'm usually really comfortable recommending methylated B vitamins because they help with the detox component of the hormones. And then starting to balance for candida, I have some favorite supplements that I use for that, which include high dose probiotics, making sure your probiotic has a lot of lactobacillus and bifidobacteria in it, along with anti-candida herbs, which include things like Pau d'Arco is one that we like to use a lot. Berberine we use, Biocidin is another one. But all of these help to lower your yeast loads. And in extreme cases, we have done antifungals where we'll use nystatin or we'll use diflucan or one of those things, but that doesn't happen very often in practice. That's if someone's having a pretty significant candida flare. I could talk about candida, probably could do a whole another, actually, we probably want to do that next, is do a lecture on candida, but I could do probably another hour on candida. I do think it's an epidemic, but for the purposes of today, one of the quick signs are that you do have a lot of bloating, you can have constipation or diarrhea, but that's typically one way you know that you have candida. Okay, so I wanted to spend some time, I've spent time on other PowerPoints talking about supplements, but I wanted to spend some time on more of the natural remedies, more of the herbs that work in this scenario, because again, I think this helped me and I definitely want it to help you too. So in Chinese medicine and Ayurvedic medicine, not just acupuncture, not just panchakarma and all these other different modalities they did, but a lot of herbs really played a big role in their literature for balancing hormones. And what they describe as PCOS with the high androgens and stuff like that, they actually have formulas for. So I can't speak Chinese. Cubby's taking Chinese, so I'm not going to butcher some of these names. So I just have the English translations of some of the herbs down. But peony root is in a formula called Bai Shou, and that one was very important because it improved blood flow all throughout the body, but specifically to the uterus, to the ovaries. It helped to push blood flow through the liver, avoiding that pattern that we just talked about, which was liver meridian stasis or liver blood stasis. They also used poria and cinnamon together. There was a concoction that was specific for that. And they used those two things together to help balance blood sugar. So thousands of years ago, they recognized that balancing blood sugar or insulin was a part of this equation. So those were the herbs that they used in particular in an herbal concoction. A lot of these are teas and, sometimes they're pills or capsules, but the teas were a big part of their regimen, or turning these into a soup of some kind. It tastes and smells terrible, but it worked. Rhubarb was used a lot. Now, the point of rhubarb was to help constipation, to drain heat, right? To help get rid of that excessive heat. And so if any of you are constipated, we know that that's probably the place to begin, right? Going back to my triangle, that gut and getting the gut to eliminate 100% is so important when it comes to PCOS. So they used rhubarb. We've used other things since, but that was sort of their pick at that time, at that point of time. And that continues to work today. Now, switching gears a little bit to Ayurveda, that's what's on the other side of this graph. These are the most commonly used Ayurvedic herbs. Ashwagandha, many of you may be on. We know it helps to lower cortisol. Cortisol plays a huge role in PCOS. It was part of what got me in trouble. It's getting all of you guys in trouble. But that, busting it, doing, staying up all night, working all day, being really stressed or having deep, deep trauma, any of those things or all of those things together trigger PCOS or polycystic ovarian syndrome, especially if you have some of these other genetics. So one of the things that's happening from a biochemical standpoint is that cortisol levels are going up in these stages of our life. It happened to me in my 20s. It's happened periodically since. But when that cortisol shoots way up, then we know that insulin goes up and we have more insulin resistance and more trouble with blood sugar or blood glucose control. So that's why managing cortisol is such an important piece. So they talked about herbs to do that. So ashwagandha was one of the best picks for managing that and taking that either in the afternoon. Some people take it at night. Some people get too stimulated by it, so they take it in the morning. But that's a strategy if you're experiencing extreme stress, and that could be driving your PCOS. Shuffery is one of my favorites. I actually take that personally. It is from asparagus and it upregulates glutathione. Now, I've talked about glutathione before. Glutathione is an antioxidant. It actually helps to rebuild cells, rebuilds our eggs, helps with our hormonal support for sure, and has been used in Ayurveda for a very long time for fertility. because I think it's literally, I haven't done the studies yet. I've have that on my brain to do at some point. But I think that if I did, I would find that Shethvari is indirectly improving egg quality and probably even egg count. So Shethvari is a great herb to take, something I highly recommend. Turmeric, everybody knows by now, poor turmeric is like, commonplace at the moment, but it's one of the best anti-inflammatories. PCOS is autoimmune. It's inflammatory. Taking turmeric 2 to 3 grams a day is helpful as well. And then both Triphala and Guggulu help the gut. Triphala is often used to help constipation. It's a blend of 3 Ayurvedic fruits and herbs together to help people eliminate and go to the bathroom. It's also an anti-inflammatory, as is Guggulu. So these are some of the most common herbs and natural remedies that are matched to those Chinese medicine concepts that we just shared and the Ayurvedic concepts that we just shared in sort of the thought process in Eastern medicine, PCOS. And I've tried to tie together for you how it merges with Western medicine. All right, everybody still doing okay? Everyone can hear? I think we're doing fine, correct? I'm going to keep going. All right, next slide. All right, essential oils. So I've heard lots, a lot of people are into essential oils, talking about essential oils, trying to balance their hormones with essential oils. Essential oils do have a place. They do help to shift biochemistry over time. I historically find that they're a little bit slower. They work, but they're slower. And sometimes we need to use them in conjunction with some of the other things like the herbs, acupuncture, stress management, diet. All of it kind of has to come together. But I do have essential oils that I have seen work in practice for PCOS, and some of these I use personally too. Clary sage is a real powerful hormone balancer and helps with estrogen dominance. Now, everybody I'm hoping knows about the concept around estrogen dominance. Estrogen dominance is when your body can't move that estrogen through, can't break it down. So you often end up with symptoms like migraines, ovarian cyst, fibroids, heavy breasts, like breasts that are just cystic or heavy. What are some other symptoms of estrogen dominance? Weight gain is a symptom of estrogen dominance as well. So clary sage is something that can help with this the way you want to take it. You want to do about 3 drops to both wrists or on the back of your neck or even to the bottom of your feet. You can also diffuse it throughout the air. And you want to do it in some sort of consistent fashion for it to truly have any kind of lasting effect. But that is definitely something you can use for sure. Ylang ylang is one of my favorite. I hope I didn't butcher the pronunciation of that, but that is a calming oil. So again, it's thought to lower cortisol levels. So that's one of the reasons that I've included it on the list. There are, of course, other calming oils too. We know lavender is calming. There are so many that are in that category, but this is one that is probably my favorite in the PCOS setting. Cinnamon, there's cinnamon oil, even as an essential oil, that actually will help to lower blood sugar as well. So trying to do just a couple of drops of cinnamon oil on your wrist, again, on the back of the neck, bottom of the feet, may help regulate your blood sugar throughout the day. This is a great one for sugar cravings. Many people with PCOS, because you have candida, you have constant sugar cravings. So if you feel like that's you, this is a great hack. Put this in your purse, put it somewhere around you, inhale it when you're starting to crave sugar, or even take a few drops maybe towards the early evening, because that may prevent the nighttime eating that many people will naturally have when they have some of these gut disturbances. All right, spearmint oil I love as well. Spearmint oil, remember, helps to lower androgens. So using it the same way, it also comes as a tea, but that is something that can help also to lower androgens over time. Sometimes if your androgens are too high, spearmint oils are not going to be enough, right? But it is definitely something helpful, as is sandalwood. Sandalwood's another oil, actually smells delicious, but definitely helps to lower androgen levels too. And I'm using the word androgens, assuming you guys know what that is, but androgens, remember, are total testosterone, free testosterone, DHEAS, even your progesterone derivatives are considered androgens, and AMH, believe it or not, that anti-Mullerian hormone is considered an androgen as well. All right, so one of the hormone patterns of PCOS, high insulin, high estrogen or estrogen dominance, high androgens, and low progesterone. So these are some of the essential oils that you guys could use to help to start balance some of that out. All right, the mind-body connection we know is so critical, and hopefully this one everyone understands, but just in the context of PCOS, we are stressed. We jump that cortisol way up, insulin goes up, androgens go up, and then all your symptoms spike. So we've got to find a way to rewire the brain to remanage stress. Unfortunately, our response to stress, no matter what that stressor is how the body, needs to be sort of treated. And so we need to learn to create a toolbox that helps us to train that or change that. So whether that's, 10 to 15 minutes of mindfulness once or twice a day, getting a massage once a week, doing acupuncture a couple times a week, but find modalities that are daily and within your home and also weekly and more appointment based that can drive that cortisol level down. That is where healing happens. And I've experienced that personally as well. I lost so much hair through, med school and residency and the stress of, all the trauma in our family afterwards. I lost a ton of hair, but I went away for the first time in my entire career after my wedding. I, got married in 2004 and actually for the first time in my life took I think 4 weeks off, and literally at the end of that 4 weeks everything came back just the way it was when I was younger. So the power of relaxation and driving cortisol down and taking care of yourself speaks volumes to prevent sort of this progression. So find the toolbox that works for you. It should be something 20 minutes daily, once a week appointment based, but working on your response to stress is critical. Now, the other piece that we didn't talk about that, again, I think is an hour-long lecture is your toxic load, right? The other reason I think we're seeing PCOS go up, remember I talked about the liver, the triangle, right? We have the gut, the methylation component, which is the liver, and then we've got that third piece of it, which is looking at the different hormone patterns. But the liver is getting so overburdened nowadays. So we have women out there who are busting it, who are doing a million things, accomplishing a lot of stuff, but at the same time, as they have this higher stress load, they're also getting exposed to a ton more environmental toxins. And the issue with that is that that in turn burdens the liver further. So we've got livers that are just essentially collapsing and driving, again, the stress hormones, insulin, and androgens up, making PCOS manifest at rates that it never did before. I feel like I meet more and more young women, 13, 14, 15 years old today, that have PCOS or PCOS-like syndrome than I did even 5 years ago. So I'm concerned about the burden of toxins in our environment and what it's doing to our hormones and what it's doing to the next generation. I think it's important to decide where you're going to focus when it comes to a toxic load. It can be incredibly overwhelming. So I always would say, look at food. Food is probably the most critical. Make sure you're eating organic primarily. If you're eating meat and dairy and some of these other things, they should be in moderation, but they should be clean and well sourced. So I think that's one way to control it. I think secondly, look at your body care products and make sure you have a lower level of toxins there. And then lastly, I would say pay more attention to both indoor air quality and also your water quality to make sure those are optimized to the best of your abilities. And finally, at some point, get tested for toxins. Make sure, that like you don't have a high load of toxins floating around in your system. And I think the appropriate time to do that is probably at least once a decade, because that's where we see shifts in liver function. And that's when disease can set in and start to take over. And lastly, stay connected to me. Remember, we're on Instagram, YouTube, Clubhouse, TikTok, trying to put information out there, trying to get us all superpowered and living our best lives. But we'll continue to put information out. Join my tribe. And if there's a topic you want to make sure we cover, please let us know. We're open to suggestion.